Hi, I'm going to talk to you about advocacy standards. So a really short presentation just to give you the confidence to know what they are. So they first came in 2002. Action for Advocacy brought the sector together to really think about what it means to be an independent advocate, because prior to this we had no defining description of what independent advocacy was, and potentially we could have had a scenario where people were doing different things. So the Charter and the Code of Practice really helped the sector be very clear about what it means when we say independent advocacy. I like to think of the standards as doing three things. Firstly, it helps advocates stay within our boundaries. It helps us be clear about what we can and cannot do. Secondly, it helps us to communicate to external people what we mean by advocacy. So when a professional might misunderstand what an advocate is, perhaps very well intentioned, expects us to make decisions on behalf of people, we can use the standards to explain to that professional what we do, and that we wouldn't, for instance, promote best interests. We're just there for wishes and feelings. The third thing advocacy standards can do is it can help commissioners. So when commissioners are looking at what a good advocacy service looks like, and when the advocacy service wants to measure itself, standards can play an important part there too. So I'm going to quickly run through each of the standards so you've got a chance to hear about them. The first one is clarity of purpose. And all this one says is that for an independent advocacy service, you need to have a very, very clear description that's easily accessible to people, which explains what you can and cannot do. The second standard, which is a fundamental principle of advocacy, is that of independence. So when we say independent, we mean that we're independent from any other service that could possibly be involved in this person's life. And because of that, we don't have any vested interest. We don't have any agendas about the outcome. What we are solely there for is the person. And that leads beautifully on to the third standard, which is being person-centred or being person-led. Specifically, we're person-led by their wishes and feelings. We are not there to promote best interests. We are not there to make decisions. We are certainly not there to give advice. We are just there to promote whatever choices that person wants to make, and that's why we say we are led by the person. The fourth standard is that of empowerment. And lots of people think of empowerment as being crucial to advocacy, because there's something fundamental in the advocacy relationship about supporting that person to take back power. Now, whether that's power to decide and control their own life or to be self-autonomous, but as advocates, we are constantly seeking, we're constantly looking for those opportunities. We are always looking for opportunities to help that person take empowerment, take back their power to self-determine their own life. The next standard is equal opportunity. And this requires advocacy services to really think about how they are meeting the needs of people from all different groups in their community, and how they can develop internal policies and practices that are really effective in challenging discrimination and in taking a stand against social exclusion. So we're looking for advocacy services to be part of this movement that makes communities and makes services more inclusive and have more equal of opportunity for people. The next standard is that of accessibility. Now, we know in 2018 that advocacy services are not always accessed by the people who perhaps need them the most. About half of people who are eligible for IMPA actually get one. About 1 in 10 NHS complaints actually is done with the support of an advocate. And in IMCA and Care Act, we know that there are huge gaps, especially from medical professionals in referring, and in safeguarding, advocacy isn't always offered the way it should be. Now, advocacy has a huge role there to play in making itself accessible. And there's an advocacy standard that says the advocacy service must really consider the accessible needs of its service users. So how are you making your services easily accessed? Do you have an accessible website, or is it quite hard for people to find out how to refer? Our next standard is that of supporting advocates. So like any well-run service, advocates on the front line need to know that the service and the managers have got their back. They need to know that they're going to be supported in what they do, and that means regular supervision, which is not a luxury, it's a must, one-to-one, regular supervision to support advocates in what they do. It also means training, and it means peer support as well. The next standard is that of accountability. Now, accountability of course means given good value for money, because this is public money. But it also means about taking time to really look at the impact you are having. How are you accountable, not just for money, but for people's time? How do you measure the outcomes of your advocacy provision? So the standards are really saying that advocacy services that are well run and well led will have systems in place to help them to capture that data in order to decide how accountable they are. The next standard goes back to another fundamental principle of advocacy, and that's of confidentiality. So, like many services in health and social care, advocates offer confidentiality. What makes us different is that we really take confidentiality incredibly seriously. And whereas there may be a pressure or a desire in other types of health and social care to share information so that people can best decide how to offer support to somebody, because we are person-led, our only responsibility is to that person and to help that person make choices and take choices that they want to experience in their life. Now, there's no such thing as total confidentiality, so there is a limit to that, and that comes in our next standard, which is safeguarding. But what I do want to say is confidentiality is the linchpin of advocacy. If we cannot offer a private space for somebody to explore their innermost feelings and wishes and desires, then we're not doing advocacy. And it's only in those rare instances where somebody really is at harm and they don't want you to share that we would need to consider breaching confidentiality. Which leads us nicely on to our next standard, which is safeguarding. Now, the way to look at safeguarding, I think, is in two ways. You have safeguarding the individual, which is tied to confidentiality and means that if somebody tells us something that's potentially harmful, we may have to pass that on. That's quite clear, and I think that your advocacy service will have a policy saying when and how you would do that. But safeguarding the standards goes a little bit further. And it goes a little bit further because there's been instances in the last 10-20 years where institutions have not looked after the people they were meant to, and there's been horrific institutional abuse. And if we think about Winterbourne and the Winterbourne inquiry, we can ask questions around how can advocacy help people to raise concerns about institutional abuse. So what this standard is requiring of advocacy services is a clarity of how you would do that. How would you raise a systemic concern that this particular service is failing in its duties to care for people? How would we do that? And the standards are really saying a good advocacy service has that in place. The last standard I'm going to mention is that of complaints, and this simply requires advocacy services to have a robust policy in place that makes it very easy for people to feedback and complain when they wish to about the quality of advocacy on offer. Now, this is very straightforward if people are able to make complaints, but what you need to think carefully about are the people who come into contact with your service who might not be able to make a complaint. So I'm thinking about people who might lack capacity, or might receive services like IMCA where they don't have a choice. So you need to think and prepare systems that encourage and make it really easy for feedback to be given about the quality of what you do. There we have it. They're the advocacy standards. They're there to keep us safe. They're there to communicate really clear expectations to people who use our services, and we can use them with professionals as well. Enjoy them.